Good morning. I'm Arthur L. Burnett, Sr., a retired judge from the Superior Court of the District of Columbia, and before then, a United States magistrate judge in the U.S. Federal Court, the first African-American U.S. magistrate judge in the history of the nation in 1969. I'm currently the National Executive Director and the Vice President of Administration of the National African American Drug Policy Coalition. Back in 1954, I became the first, we were called Negro or Colored, to enforce Brown versus Board of Education, and was selected to become the lead plaintiff in the Prince Edward Farmville school cases in order to implement the Supreme Court decision of desegregation in education. Since I made that sacrifice at 19 years of age to deal with desegregation in America, and later became special assistant to a gentleman named Robert F. Kennedy, and his eyes and ears in monitoring the Martin Luther King movement. As a judge on the court, seeing how many youngsters, especially minority youngsters, throw away their lives and their opportunities by getting involved in drugs and so forth, I felt a commitment to deal with the problem of prevention of teenage youth becoming involved in illegal drugs and in juvenile delinquency conduct, because they're throwing away the very opportunities that I put my life on line for, to give them the opportunities to be whatever their intellectual capacity would permit them to be doctors or lawyers or so forth. Let's not self-destruct and get involved in drugs and crimes and violence when the very things that Thurgood Marshall and Martin Luther King gave their lives to open doors of opportunity where a person, and this was her theory, could become president of the United States of African American descent. That's before I heard about Barack Obama, of course. And so the coalition actually now has 26 member organizations, just like a United Nations. And through those member organizations, we have over 1 million black professionals that are working in an area of getting treatment for substance abuse and treating substance abuse and incidental possession of drugs because of the craving as a health problem rather than bouncing people in and out of prison. We come up with a youth program which involves self-determination and black professionals reaching back and being counselor mentors for kids starting in the 8th grade. So every black kid today who says he wants to be a doctor or she wants to be a doctor in 8th grade will get a doctor as a counselor mentor to guide that kid as if that kid were his own son or daughter. When the medical profession said they would do it, so could the National Bar Association, so did the social worker. So every national black professional organization is supporting our initiative, which is part of the president's We're Brothers Keepers initiative. Our program, for example, we send speakers into our public schools and in our private schools on a 72-hour notice to talk to kids from the 3rd grade all the way through high school on a year-round basis about not getting involved in drugs or underage drinking, not getting involved in juvenile delinquency conduct. So instead of the mass incarceration we have today, hopefully in 10 years, we will turn this country around and we will have a prison population of 300,000 to 500,000 maybe for violent criminals. But kids who had the intellectual capacity, we are using the black professionals as mentors, but not only mentors, counsel mentors, in order to inspire and motivate. And I go into schools and I tell our speakers, number one, talk about the health consequences of underage drinking, how it impairs the judgment, how it impairs the intellectual ability, your memory operation, your reaction time, reflexes. And then we tell them, but we're not here just to tell you negative things and tell you what you should not do. We're here to tell you what you should do. I talk with people. I've talked with individuals who actually were teenagers or as young adults in prison. But they changed their attitudes in life and came out and went back to school and became masters of social work running drug treatment facilities. I run across people who have had prior criminal records who have become doctors. What America does not realize, that many people who go to prison, and that's another one, come out. And when they come out, they are more committed to go straight and to give greater service to society than people who have never fallen from grace. And I would say 30 or 40% of many people you run into have a criminal past, but today they are major contributors to society.